I also know that you've just finished your internship year. What was it like? Could you tell us more about it? And did the doctors treat you guys differently from the Hong Kong interns at all?
Well, yeah, so I have just finished my internship in July. So it was a year of internship for me. And we do it in 4 rotations. So I did mine in medicine, surgery, peds, and obs and gynae. You could also double up the medicine or the surgery, or you could also have orthopedics instead of pediatrics or obs and gynae. But they require you to have at least 1 medical rotation and 1 surgical rotation. And each rotation lasts for 3 months, and you'll be rotating between different hospitals as well. So to answer that question, Clarise, they don't treat you differently. Sometimes it's actually a useful thing because there are loads of local slangs that I actually didn't realize. I mean, I did some of my internship in the UK, but even then coming here was a totally different story. So your daily routine work can range from things like discharge summaries, which some of you are probably quite familiar with. And there are also things like taking bloods, but also, you know, you're the first port of call for things like, you know, there's a patient who is now febrile at 39 degrees. There's this patient who has desaturated and is on 10 liters of oxygen. You're the first port of call that nurses call to assess these things as well. And actually, sometimes it could be quite fun. Sometimes it could be quite challenging, but what I found was that this year of internship was actually really useful as a base for me to work towards my residency in Hong Kong as well. Because as you rotate through different hospitals, you meet different people, different professors, different colleagues, and also the local graduates as well. And actually, if you're thinking of working in Hong Kong for a long term, it's actually useful to have some friends in those local areas as well, so you feel a little bit more at home. Now, one of the things that everyone always asks me about is, are 36 hours on call actually a real thing? So yes, it is a real thing. In some hospitals, you can have half day off. So that means that you'd be, for example, if you're on call on Monday, you'd be working from Monday, let's say 8 o'clock to all the way to Tuesday, 7 o'clock or 6 o'clock, if you're working for 36 hours. So that could be quite difficult on your stamina and on your concentration levels as well. Are you able to sleep during the calls? It depends on how your calls are like. So obviously, if you've got quite a lot of unstable patients, then yeah, you won't be able to sleep. Whereas if you have some more sort of stable patients and that your team in the daytime has been doing things pretty well, then you might be able to have like maybe 2 or 3 hours of sleep. And normally they provide an area for you to sleep as well in the hospital. So they do kind of expect you to have some sort of sleep. But yes, 36 hours is real and it can be quite tough. So I think that's one of the sort of starkest changes I've realized since coming to Hong Kong is that, you know, 36 hours could actually drain me a lot. And yeah, so I mean, you will accommodate towards it, you will accommodate anyway. So having some colleagues, so having some friends in Hong Kong also helps. Yeah.
Okay, what about your story, Raymond? Have you ever experienced the 36 hours on call, and what was your internship like?
Wow, it's been a while for my internship in 2018. Yeah, well, it was tough. It was pretty tough. As what Grace explained it before, 36 hours on call is quite rare for most of my rotations. Compared to my life back in Australia to Hong Kong, it's much busier. We get lots of admissions. It's quite busy all the time. You get to do a lot of different random jobs, like setting up half blog will be very familiar for the interns in Australia. But sometimes you are asked to do some quite quick stuff, even admissions for 3 patients within 1 hour or within even 15 minutes. It's quite common in the medical rotations, and you are quite busy through the whole night. CPR resuscitation is very often. Yeah, I do remember I got a pretty tough time in the first few weeks when I was an intern back in Hong Kong. Like, I'm not familiar with the computer system. I'm not familiar with the jargon that people they talk about, but etc. about the TPN in Hong Kong is quite difficult in the first week to know with the working system, and everything very quick and fast in all the way doing things. So, but it it wasn't too hard to adapt to the system in Hong Kong. Thankfully, colleagues like nurses and seniors are quite nice to me at that time when they know, oh, I was from overseas. They get me through some process, what I should done. Okay, in such a situation, what should we be doing? What should I do and not to do? And give you some local references like the Houseman handbook, or what sort of guidelines the hospital using for different clinical conditions. That really helped me a lot. So don't hesitate to make friends, like what Grace said. Be friends with other interns. They are also fresh to the medical system, so help out each other. And all of us should be a doctor who did some clinical work before, so we shouldn't be too hard for us to make proper clinical decision on certain conditions. Just the matter the system, how it works in Hong Kong. Once you get through to know the system, okay, how you book CT scans or urgent CT scan, urgent ultrasound scan, and what or whom you should call in different situations. When you get to know all of this process well, then it won't be too hard for any experienced intern in Australia. So don't be too nervous. It isn't too hard. It will only take you a short time to adapt the Hong Kong system, and I'm sure all of you will do as an experienced doctor in Australia.
So I guess it does take quite some time to get accustomed to the Hong Kong system. And now we will move on to the live Q&A session. Is there a registrar during on-call where one can ask for advice if needed? How many registrars and interns are there usually at night, and roughly what is the patient load? Thank you.
Well, let me do it as a registrar right now. Yeah, well, we definitely will have. So what you do every night or on all the on-call day, you get to admit the patients. After you have done your admissions, your junior registrar will redo or sort of like review your admission notes, and he or she may add on some extra information like the history, physical exam findings, or extra investigations that he or she would like to add on from what you have made before. And then depends on rotations. Like in surgery, we usually have 2 rounds in the day, or 3 rounds. So the general morning round and the afternoon round before we leave, and then we have a night round. So around 9 o'clock, 10 o'clock, all the seniors on course of the day will get back to the hospital, review all the cases in between the afternoon and the nighttime, and you are allowed to ask questions to all your seniors. Actually, we do have at least 2. In surgery, we have 2 seniors registrar will be on site during your call time, and there will be 1 off-site senior call as well. So don't worry, you will definitely get someone at your back to help you and support you if you get difficulties on what you should do, or like even problem in putting Foley catheter. There will be your seniors around to help you out, or even your decision whether we call like urgent medical consultations or even intensive care unit support. We definitely get your senior to help you to review the case and give you advice, or even sometimes myself would do the call on my own straight away. So don't be too nervous. You always get support from your senior. Just work smart, be polite and humble by the time when you ask questions. Think why you need to ask for such and such process before you ask. That would what I'm looking for from my juniors.
I can add to that as well from an internship perspective. So you were asking about the workload and the patient to doctor ratio. So I can tell you that the workload is probably a little bit more than what you're used to, especially since I'm from the UK. So in terms of some specific figures, I'll tell you how it works in medicine at Prince of Wales right now. So right now, first of all, we have a dirty team. So we'll put that aside for now, but normally there will be 4 to 5 interns covering the whole Department of Medicine. So we will be, when I say covering, what I mean is that, you know, if there are urgent bloods that needs to be taken, if there are urgent scans that needs to be done, then that intern will be responsible for it. And if a patient deteriorates, then the nurses will also call the intern. So when I say 5, I mean they're sort of allocated to different wards. So one person would cover maybe like 4 to 5 wards, but I know that in some smaller hospitals they can cover up to like 7 or 8 wards. And obviously, as you know, Hong Kong's wards are pretty packed as well. So it could be quite a lot more than what you're used to. And then there are also other places, like for example in Twinman Hospital for pediatrics, I was the only intern in on site for all of pediatrics. So whatever happens, even if it's neonatal, NICU, or like general pediatrics, if someone comes in with a problem, if there are new admissions, then you're the one responsible for it. But yeah, I do agree with what Raymond said as well. Like, don't be afraid to ask questions. There are always sort of seniors just above you, and it depends, obviously. Like, at the start of the year, people are very happy with you asking questions, and people do understand that Hong Kong has quite a stressful working environment. So don't be afraid to ask questions. Recognize your limitations. That's the most important thing. And I think somebody also asked about on-calls. Should I take that as well?
Yeah, sure.
Sure, yeah, you just lived it. Like,
So,
you finished 18 days ago, right? I mean,
yeah. So 36 hours of on-calls. So the maximal legal limit to have on-calls is what we call 3-day one call. So for example, if you're on call on Monday, your next on-call, the next legal on-call will be on Thursday. So so that's Monday night, all the way to Tuesday night, and then you're off. And then Wednesday you're working again, like up to sort of normal hours, like to 6 or something. And then on Thursday you'll be on call again to Friday. So you could have up to 7 to 8 calls in a month. But also bearing in mind that there are some hospitals that have long and short calls as well. So short calls means that you probably finish at 10 or 9 or something, and then long calls do it overnight. So it really varies between hospitals. Some hospitals certainly have post-call half days, which means that you can leave after 1 p.m. On the next day. So that might be a little bit easier, but it depends on where you want to be. And also what's different between Hong Kong and, let's say, UK and maybe Australia is that you don't really have sort of post-call days off. It is most of the time a 5.5 day week. So you work on Monday to Friday plus or minus on calls, and Saturday or Sunday will be half day as well. And you don't get a sort of compensatory leave in between for your on calls. So that's one of the things to bear in mind of as well. Yeah, so I've answered.
Okay, thank you. So we might move on to specific questions for panelists. There's a question for Dr. Marcet. You mentioned that you started off with the 6 years limited registration before sitting the exam. Did you still have to complete an internship year or after, or was it bypassed as you were already experienced and a senior doctor?
yeah, it's a great question. So I gained my specialist title, the FHKM in ophthalmology in Hong Kong here during those 6 years. So what that did at the time was it gave me half off the internship. So they also recognize other fellow level qualifications. So if you have a fellow level qualification in several countries that I know that have been recognized, then you'll get half off the internship. Apart from that, in May 2019, so just last year, the medical council approved the exemption of the entire internship for folks that have already been working for 3 years in different various public systems. For example, either of the 2 local universities, the Department of Health, or the HA, all 4 of those institutions, if you work 3 years on a limited registration in those capacities, then you would be given fully exempt from the internship. That came out after I did my 6 years. So under the current guidelines, I would have been completely exempt. Yeah. Yeah. Anyways, but so if that applies to you, that would be worth noting.
Somebody asked, do you do 36 hours as an intern, or are you required to do that during your specialty training as well? So as a rule of thumb, your on-call numbers do decrease, hopefully. So like previously I had maybe like 6 to 7 calls a month, but now I only have 4 as per this month. And I also have post-call half days as well. So I no longer have to do 36 hours. But obviously, like, you know, that doesn't mean that you could just leave like after, you know, your half day. Like there are things like, for example, Raymond is back at his office on a Saturday afternoon doing things. So, you know, you're expected to stay during the whole course of your surgery if you're a surgeon, even if it's your post-call half day off. But yeah, so your responsibilities will become a little bit more different as you progress, as you might have guessed, and on calls tend to be a little bit less on you know, the frequency, but you know, obviously you have different responsibilities. How many night shifts per month are compulsory in internship? I mean, I think that varies between 5 to 7 or 8. So yeah, and also terminology as well. So we don't actually do night shifts. So if you're on call on a Monday, I keep saying Monday, but you know, if you're on call on a Monday night, you are expected to be at work at 8 a.m. or 7 a.m. on that Monday as well. So it's different to Australia and parts of Europe where, you know, you're only expected to come in at 8 a.m. or 8 p.m. or 10 p.m. or something. You know, you are expected to do your normal duty in the day to carry on through the night, and then your normal duty of the next day, and then you're off. So yeah. I hope that answers the question.
There's a question there about time for attachments during the internship. You get 6 days off per 3-month attachment. So there's four rotations in the year, and each one of those 4 rotations, obviously 3 months. So 6 days off during each 3 months. People commonly do a 3-day attachment when they go and they spend time at wherever the attachment site is. In the specialty that they're interested in. But usually 3 days is enough for that team to get to know you and perceive that you're obviously interested in their team. Oh, this one here, exempted from internship. I kind of think I answered that earlier, but as an overseas specialist, yes. So I had already been here long enough that I wasn't just an overseas specialist. Parenthetically, they don't typically recognize any of the American specialties as a specialty qualification. The training is different, they say. And so for whatever reason, that's not why I got half off. I got half off because I had been here long enough that I had also become a specialist already in Hong Kong before I even got a full registration. And I did that under limited registration. So you can certainly do that. But in terms of other jurisdictions, the UK fellow in the Royal College of something or other, like whatever the specialty is, typically those are recognized. So far we've seen exemptions come from Australia and Singapore as well. So anyone that's gotten a fellow, even it could be like Australia has the fellow in the Royal College of GP or something along those lines, that will also get you half off of the internship. Hopefully that helps.
Somebody asked, what is the specialty application in Hong Kong like? Someone asked, how is entering specialty after the internship year work? I heard that it's a lot more of the traditional style where you know certain people connection, you're more likely to get into your desired specialty. Is that true? And then somebody asked how important it is to have a good portfolio to decide on specialty training. Will this be looked at? Raymond?
Oh, okay.
Raymond can answer the surgical side, if you want.
Yeah, well, of course. Well, okay. Let me talk about from bit by bit, step by step. By the time when you're as an intern trying to apply for specialty training in Hong Kong, first of all, try to get to rotations that you keen to work in your future career. Like myself, as I wish to be a general surgeon, so my first rotation was surgery. And I tried to get a hold to know the people well, to stand out quite well. And yeah, a bit lucky I got the best intern. And that would really help, regardlessly on what rotation you're doing. Try to be very active to get your senior to know you when you're as an intern. At the end, towards the end of each rotation, get reference letter from your senior. That would be very helpful on your specialty applications. So if you start on your training or internship by July, specialty application will start from about September or October. But the way is you approach to the senior or like the triple service, like each department, like for example, for myself, I approach to my the COS by September, email him, say, hi, this is Raymond, previously worked in your department before, wish to work on your department as a specialty trainee in the future time. And they will have a sort of like informal interview with you, sort of like selecting the candidates they wish to adapt in your future training positions. Soon after that, after the first screen, then you have the second round, the formal interview. Generally speaking, if you are able to get to the second round, sort of is like they're going to get you to their specialty training. So once you get everything done, then you get to apply your training through different college. Once you finish up all your applications, then you get onto your specialty training. So portfolio is definitely important. Back in the day when I was in Australia, although I wanted to be a head and neck surgeon, I did attend some other head and neck dissection course on my free time, even the temporal bone course as well. So it definitely made my profile higher than other candidates, and even with the 2 best intern references as well. So do work hard in your internship time and also at the time when you are a student. Try to get to enroll to more courses, see more, learn more, and be active. Interact with your seniors when you're an intern in Hong Kong to let them to know who you are. Even if you're not able to get onto the rotation that you aim to work in your annual leave time, send email, apply for attachment to different departments, say, oh, I'm home, I would like to have an attachment to your department in my annual leave time. I wish to, I'm very keen to be a trainee in your specialty. Can I have a chance to attach to your department so that I can experience what is the working style like as a trainee or as a doctor in this specialty? Generally speaking, you are able to get to go on to do this attachment. Once you get familiar with these people, that will help you a lot to get on the specialty training you want to get. So you have to be proactive and plan well before you apply. But main thing is your own enthusiasm to show in front of all the seniors. When they get on to know you well, you will definitely get your position.
So to add on to that, yes, I do agree that internship is very important. So previously I've talked about putting your preferences down. So if you know that you like to work in a certain hospital for a certain specialty, try and put that down as your preference. You might be able to swap if you don't have that preference. And also, you know, as Raymond said as well, you know, if let's say you want to work in Prince of Wales for medicine with me, then, you know, if you don't have that as your internship, you can go for attachments. That's another way for them to know you as well. And actually just a little bit more of like a personal story. Your side. Yeah. I was actually planning to be a surgeon all along. But then actually it was till my internship in medicine that I realized that I actually really like the way it works at Prince of Wales. And so I filed in my application, I've approached all of the COSs for surgery, but then actually in the last minute I said, you know what, I'm having second thoughts. You know, what about medicine? So then I approached my previous COS, which is a chief of service for medicine, and I told him my dilemma, and he was like, right, yeah, we'll you know, we'll like to have you, because he knows that he's worked with me, his team has worked with me, and they've got, I guess, good comments about me, and so that made it a lot easier. So try and be an intern at their department. And somebody else asked about portfolio. Now, you know, obviously any research would be beneficial, but I would say that in Hong Kong, they actually value internship and your performance a lot higher than, you know, what you have. Like, you know, you could have 20 papers, but if you're awkward in dealing with patients, you know, if you've done, if you made like serious errors during your internship year, then, you know, 20 papers wouldn't do. So I think that's the difference between, let's say, Australia and the UK than Hong Kong. It's also, I mean, after, you know, approaching your COS and all of that, and September and October, by around sort of February and March, you have a formal application to give in as well to HA, and they will then have an interview. But most of the time by then, most people would know where they might be going. So yeah, that's the difference. What is the major difference between practicing in Hong Kong and in the city that you completed medical school? Except for the language part, is the style of interaction with the patients, workplace culture and such very different, or does it depend on what hospital you work in? So yes, it really depends on what hospital you work in. And yes, you know, it could be quite different, as you know, in Hong Kong. Actually, it actually depends on the area that you work in as well. So for example, when I was working in human pediatrics, I was dealing with quite a lot of cases of child abuse. I'm assuming if you're working in Queen Mary, then you're dealing with patients who, you know, might be able to afford private scans a little bit more maybe. And in Sharton as well, you know, that could be quite different. So, you know, that's something to bear in mind as well, but it can all be very interesting. So in terms of the style of interaction with patients, I do find that the Hong Kong style is a little bit more paternalistic than what I was used to. In the UK, it was very much a sort of like patient-doctor communication. You know, let's all come and discuss the management plans and all of that. Whereas in Hong Kong, it could be a bit dictational. But, you know, it doesn't mean that it's a bad thing. Sometimes, you know, if you've got an 85-year-old little grandma who doesn't know anything on medicine, you know, you can actually tell them what you think is best. So, and the other thing that really shocked me was that, you know, when they were doing their rounds, they wouldn't actually pull the curtains around the patients. And I was like, well, you know, if I'm discussing that, you know, something confidential with this patient, then, you know, wouldn't it be better if you close the curtains? That was something that I was really used to in the UK. And actually, you know, Hong Kong is hectic, but there are different cultures that you have to be aware of, but there are also things that, you know, you could bring to the culture. So for example, you know, since I've been working with the interns, interns and residents as well, like, I always take pride on letting the patients know what we're doing, like why are we taking bloods, because we want to check your renal function, your kidney function, you know, just little comments here or there. You could bring your culture to Hong Kong as well. You know, it doesn't have to be you working as a slave in Hong Kong for them. You know, they do appreciate your experience as well. And the other thing is the workplace culture. So as I said, we don't have a morning team and a night team, so we don't really have handovers for interns. So that's something I found quite difficult. Like, how would you know that a patient was critically unwell? Well, we rely on the nurse a lot as being our sort of connection between different teams and different doctors. So those are things that I found pretty interesting. And, you know, I do see merits in it as well. So yeah, how would you comment, Marcus?
This could almost be the topic for another webinar, really. It's too much to talk about in a brief answer. There are differences. Yeah. Not even sure where to start, but no, right now I'm in private practice, and so it's yet very different from my previous experience. And the Hong Kong U one, when I worked at Hong Kong U as a faculty member, was very different from the internship. So it's almost here, it's almost like 3 different chapters. And each one has been very unique in its own way and interesting. And I look back on each one of them. So it's been a growth process and a journey. I think, as I said earlier, actually, if you have your doubts, then a limited registration could be a very viable option to demo or sample Hong Kong, if you were, keeping in mind, though, that it's a very specific aspect to it. And should you change your setting here, then obviously that's going to change as well, as I just mentioned. So again, it could be like a whole nother webinar. Let us know in your comments if we should be doing such a webinar. Maybe Raymond's got something to add about that.
Well, similar to what Grace explained, I talked before, the morning and night handover would never exist in Hong Kong. So the communications really depend on the nurses and the white or you notice something you have done not done by the overnight doctors. And well, compared to my life back in Australia, I would say it's much easier. I had more patient load every day, while I try not to sacrifice my time to talk to patients. Like Grace said, well, you don't have to be changed by the environment in Hong Kong, but you can also make some changes. Like personally, I still keep the habit back in Australia. I always try to talk to patients more, like in my morning period run with my consultant. Uh, Hopefully, I will get back to hospital by 6:30 in the morning. Try to get myself a decent time to review my patients, not in a rush manner, but I got a time to talk to them. Hey, how are you? Like, have you eating well, doing well? Any other issues? Some checks, like, you can keep on your own style with your patients. You don't have to change to the style that used to be in Hong Kong. um, well, so yeah, but definitely Hong Kong require much more efficient and like a faster pace at work. But I think there is room for you to maintain your own style to work or how you treat your patients. So don't be too nervous. I still try my best to check the patients out more as much possible. That would really help on the communications with patients, adhering to your treatment regime. And so, yeah, yeah, I think Grace already explained about, like, just make sure you familiar, yeah, how much seriously.
Time. I'd like to thank you guys. I'd like to thank the panelists and the HKMSA as well for joining us. And we'll wrap it up. See you again soon then. Hopefully.